Welcome to the American College of Surgeons Bulletin Brief from the Frontline Surgeons' Voices. We recently held our annual Pfizer Humanitarian Awards during our Board of Governors dinner, as traditionally held on Tuesday during our annual clinical congress. This year it was a virtual event, of course. And we already heard a little bit from Dr. Garma Tefera, who leads our Operation Giving Back project within the American College of Surgeons. We heard a little about it, and we're now going to meet two of the awardees. Welcome, gentlemen.
Thank you.
Let's start first with Dr. Kantar, and Dr. Kantar, you congratulations to both of you, of course, but you got an award for the resident category, which is pretty hard to imagine considering being a resident and still having time. So tell us a little bit about where you are and what you do to start.
Thank you very much, Dr. Wexner, for this fantastic opportunity. And I'd like to start off by thanking the American College of Surgeons, Board of Governors, and Operation Giving Back for this incredible honor. And I really feel very humbled to be part of the other recipients. And I really hope to accomplish up to 5% of what they've accomplished. So I'm a general surgery resident at the University of Maryland Medical System Shock Trauma Center, starting my plastic and reconstructive surgery training at NYU in July of 2022. And I was fortunate enough to get involved with a nonprofit organization called Global Smile Foundation, based in Boston, about a decade ago. The mission of the foundation is to provide comprehensive cleft clinical care services to underserved patients around the world. And that include surgical services along with speech, psychosocial, and all of the ancillary services associated with cleft care. In addition to providing our clinical services, we try to make our initiatives as sustainable as possible, as longitudinal as possible. And our goal really is to build capacity at the sites that we visit. And we try to do that through supplementing our clinical activities with educational and research initiatives. And throughout the years, I've been fortunate enough to work with a stellar team at the Global Smile Foundation. And as of now, I'm part of their committees for research, education, and the surgical committee, as well as the internal review board committee.
Fantastic. Well, congratulations. That's a great accomplishment. Let's turn to Dr. Jeng, who is in Taiwan and in Kaohsiung in the south of the island. And Dr. Jeng, congratulations, and tell us a little bit about your practice and about what you did to merit this very high honor.
Thank you. It's a great honor for me to accept this award. I'm a plastic surgeon. I major in the microsurgery in Taiwan. I trained at the Linkou, Taipei under Professor Fu Chunwei. In 2002, we are invited to join the NGO foundation from the United States, the Operation Smile. They have majority, they did the credit and party for the children, but we do the microsurgery. The first time, 2002, we are invited to the Hanoi. Immediately, this organization, we do the free for the congenital disease and also the tumor excision and also the burn injury after the trauma. Because every surgery needs at least 10 hours, so we need to pre-screen the patient. Usually, if every mission, we do 20 cases, and we need to pre-screen almost 100 patients. The first time we joined, and we realized, no, there are so many people need reconstruction. So we cannot do all for them. At that time, we decided we should do the trainer approach. We do the mission by the teaching the trainer at the local hospital. Every time we do the mission, we interview the candidate for the fellowship to Taiwan. From that time, we have at least trained at the 5 microsurgeon from the Vietnam to the Taiwan for 1 year, the advanced microsurgery. Then they go back to Vietnam. So every year we using the charity mission to work with the student we train, do new technique for them, and sometimes we learn a lot from them. Since that, we have done 20 years, and almost every year we will go back to the Vietnam to see the trainer and also our patients. So that is the story.
Well, it's a very impressive story, very inspirational indeed. Creating sustainability, of course, is the best way to create these programs rather than just go in and leave again. The sustainability aspect is admirable. What type of time commitment would you estimate for yourself, Dr. Jeng, like number of hours per month or weeks per year, any units you'd like to use to quantify the kind of effort you're putting into what you do?
Every year I spend twice to the Vietnam, and every time is 10 days to 2 weeks. So basically, it's a short mission, but important is we train the student there. If they have any question or any need to help, they will telephone us, and we will discuss with them. The other thing is we try to set up the safe principle for the surgeon in the Vietnam. Before that, the Vietnam, they are not used to report the so-called complication, almost zero, but we try to set up the safe guideline for them, and that is international. We bring all the workshop and the speech, and to let the government to know this is very important for report the complication. So this is the what we done.
Yeah, that's fantastic, introducing that aspect, the audit component for continuous improvement. Dr. Kantar, you're busy being a chief resident at Maryland Shock Trauma, getting ready to go to NYU, Global Smile Foundation. What's your time commitment?
Typically, I try to use one of my vacations per year to travel on a clinical mission. 3 to 4 years ago, we started our simulation-based educational comprehensive cleft care workshops. So I typically use 1 or 2 weeks from my vacation time per year to travel to a mission and to the educational workshop. Otherwise, I'm consistently involved in mentoring our research fellows through regular Zoom calls and regular virtual meetings. I would say about once or twice a month. I feel like I was also fortunate enough to train in a residency program that offers the 2-year research time or academic development time between our 2nd and 3rd year of clinical training, through which I was able to do a big bulk of the work that I've done with the foundation. But I also like to take this opportunity to encourage all trainees, residents, and medical students to not feel overwhelmed about getting involved with outreach surgery, international surgery, and global surgery, which is definitely what I felt when I initially got involved. And the piece of advice I have for the trainees is to start small or start somewhere if they're interested in these types of initiatives. I remember I started very small with a local fundraiser in the United States. The first mission I went to before starting as a resident was as a photographer. And then as I grew throughout my residency training, I got more and more involved. And so I try to think of it as a longitudinal commitment rather than a one-time type of thing.
Well, again, it speaks to the sustainability to build an enduring program to really make a difference, and to do that for your own self, to continue to stay engaged. So that's wonderful. And I'm sure taking what sounds like at least 2 weeks of vacation, and you probably only get 4. Dr. Jeng, are you getting other surgeons in Asia interested in participating in these type of programs?
Yes, not only the microsurgery and the other congenital deformities, such as the congenital ptosis of the eyelid, and also the congenital hand, and also the quadrip and palate repair. We do as much as possible. This is guided by the NGO Operation Smile, funded in the Norfolk, Virginia. We were asked by them what technique they need. So we will bring our staff or also my mentor to go there and to serve for the people. but most of time is for the train the trainer approach again. We not pick up the difficult case. We focus on using their opportunity to teach the local doctor, and we hope they can serve their own people.
Fantastic. Again, congratulations to both of you. It's great work. It's interesting that you're in sort of similar spheres for what you do. And there's a lot of great things happening. I would add, having years ago been on the awards committee for this program, I remember the astonishing number of highly qualified individuals and the fact that you were selected from that group, which I know in this day and age is even larger than it was back when I was in the committee in the early days of it. So it's a clear attestation to your commitment, to the quality of work you're doing, the quantity of your lives you're devoting to it. You're inspirational, and I hope that many of our viewers and listeners today take heed and seek out similar programs for themselves. So thanks for all you do for humanity.